Good evening. I'm Phil Goropoulos, president of CHI St. Joseph Children's Health. Thank you for joining us for the latest installment in our Conversations About Healthy Communities series. Many years ago, when St. Joseph Hospital was first founded here in the Lancaster community, the sisters came with the hope of creating and building a healthier Lancaster community. Our mission continues to be that, and we hope that these conversations with individuals from across the country help to inspire us and answer some questions that we might have as we continue to struggle with what that means to create a healthy community, what steps we can take, and where people have seen success in other areas of the country. Today, we are joined by Mike OLoughlin, who is the National Correspondent for America magazine. Mike's work has really written about the Catholic Church and Pope Francis and in many different elements and strategies throughout his time. What caught my eye this particular last summer, I'm sure I read many of Mike's articles in America magazine, but really got to know his work this summer when I was listening to his podcast called Plague, the Untold Story of AIDS in the Catholic Church. So please join me in welcoming Mike to our conversation. So thank you, Mike, for joining us this evening. Appreciate your time. And like I said, I really appreciated your podcast as someone who had worked in HIV for many years before joining Catholic Health Initiatives. I found it tremendously interesting to learn more about the church's role in addressing the pandemic here in the United States. So,
Yeah, I mean, I was learning it all for the first time myself. So it was fascinating to learn about this really vast history about Catholicism and HIV and AIDS in the U.S. I really had no idea that the church was so involved in that ministry.
Yeah, I think there's so much about the church because of how we operate as a religious institution that many of our parishioners and the community as a whole don't understand what has happened. We're going to talk about plague and the podcast in just a little bit, but I found a lot of ties similar. Like a couple years ago, I purchased a book for all of our staff called Church of Spies. I don't know if you've ever read it, which was about the church.
I have not, no.
It's about the church's role in World War II and fighting against the Nazis. When you hear so many like misperceptions, like where's the church supportive, like, and because there was silence, but this book really delved into a lot of what was going on behind the scenes at the Vatican and using cardinals and bishops and priests in different parishes to be able to really undermine the Nazis' efforts at success, but doing it in a way that allowed the church to kind of not openly engage, but definitely seemed like they were at least putting their thumb on the scale of justice. So I wanted to start by talking about this past summer. Like while I was listening to your podcast, you were recording the different segments. Many segments of the community, I like to say, were kind of awakened or had their eyes opened to a lot of the struggles and the realities that are being experienced by minority communities and marginalized communities across the United States. So whether it was like George Floyd's murder or the Breonna Taylor murder, whether it was the health disparities that we were starting to finally read about and talk about in a more public way that really were highlighted by the COVID pandemic, certainly not created, but certainly highlighted. And even currently with the water crisis in Mississippi, where we have towns that still do not have access to clean water to this day after, over a month since the storms that had damaged their systems. Pope Francis has called for the church to be a field hospital and not an ivory tower. And I was curious, your perception over the past 8 years, since Pope Francis was elected, we just marked his anniversary, I guess it was yesterday or day before. Have you seen movement and progress towards his vision of this field hospital? And what changes have you seen in how the church is engaging marginalized and disenfranchised communities as a whole?
Yeah, that's a great question. I feel like everything else in life, that kind of looking at the efficacy of Pope Francis to try to sort of reorient the church around certain issues of social justice, it's all been kind of delayed because of the pandemic. I feel like, at least in my reporting, which I cover the church in the United States and a little bit of the Pope at the Vatican as well, there has been kind of this hyper focus on the pandemic and the response to that. But I do think one kind of interesting aspect of that has been the church's focus on communities that have been especially hard hit because of the pandemic. So like you mentioned, this has shown us the health disparities that have existed for a long time in this country. Kind of poor communities, communities of color who have difficulty getting access to healthcare. We saw that exacerbated in the early days of the pandemic. As we're going through a vaccination process now, we're seeing those disparities play out still. And one kind of general point of light in the US Catholic Church is its healthcare ministry. And I think we're seeing Catholic Health Association step up during the pandemic, for example, and talking about how Catholic healthcare can better respond to those needs. So I wouldn't say that they're doing that work because of Pope Francis. They've been long been leaders in advocating for the poor and marginalized, but there is sort of that symmetry between what the Pope is calling for and what Catholic health leaders in the US are calling for. So even during a time when I think everyone's kind of shifted focus back to the pandemic, we are seeing the Catholic Church here in the US being a voice reminding the public and political leaders that there are communities who still are not receiving the kind of care and access to care that they need.
How, I guess in particular, I'm thinking of there's a priest I follow in the Atlanta area, an African American gentleman who has talked about the need to create a greater and stronger dialogue between the church and minority communities in particular, and find ways to embrace and affirm them and their unique spiritual needs, as well as staying true to church tradition. Have we seen a growing movement towards that, more embracing of kind of the diversity of the laity that is seeking guidance from the church?
Yeah, I think we have. You mentioned earlier the racial justice movement that we saw really come into the public consciousness last summer. And I think around that, especially in Catholic circles, you did see this conversation starting about how the Catholic Church in the United States is engaging communities of color. There's a lot of statistics out there that show the church is much more diverse than what especially the leadership looks like, which is mostly still white. But the Church in the United States, by some estimates, is as much as 50% Hispanic. There's a smaller but vibrant African American Catholic community in the United States, and then of course there's communities from all over the world, especially immigrant communities who are Catholic. But around the issue of racial justice in the church, there's been a lot of really interesting and challenging conversation about how Catholics in the United States, especially white Catholics, can do a better job of listening to the needs of communities of color in the church. I'm thinking of an interview I did with Father Brian Massengale, who's a theologian at Fordham University, a Black gay Catholic priest who talks a lot about kind of the need for justice among all different kinds of communities in the church. But he has some challenging stories about what it's like to be a Black Catholic, what it's like to be a Black Catholic priest. And the interview I did with him last summer, we did a video interview, and I still get so much feedback on that interview from people who watched it and loved it because it challenged them, and people who watched it and didn't love it because this is a difficult conversation to have. One of my former colleagues at America, Olga Segura, has a new book out about the Black Lives Matter movement and the Catholic Church. It's called Birth of a Movement. And she's a young writer who's talking about what it's like to be a person of color in the church and some of the challenges that she's faced and room for growth that she sees today. So there are conversations happening. I think it's easy sometimes to ignore them if you don't seek them out, because these conversations are difficult. As I'm sure you know, matters of justice and equality and equity can be challenging for people who are not used to having these types of talks, but they are happening. And I would encourage people to, check out I write for American Magazine, a Jesuit publication. That's where I've done some of these articles. People should check it out and see what others have to say and kind of look for a different perspective than they might be used to.
Yeah, I think it's fascinating to look at it also from the outside, that I think so many people look at the Catholic Church as somewhat like of a monolith of a stereotypical white male, because so much of the leadership is that. And I think we are starting to see some of that change with the appointment of the Archbishop and Cardinal in Washington, D.C. I thought was a great move, not only because I align very well with his theological approaches, but that level of visibility I think is so important and has been so missing for many in the community, that the rest of the world, the non-Catholic world, doesn't necessarily realize as a part of our congregations and our parishes.
Yeah, Cardinal Wilton Gregory was the Archbishop of Atlanta for a long time before Pope Francis moved him to Washington. He's the first Black cardinal in the United States history, which I think shocks a lot of people. But the more you dig in, you realize that there's been a strong, vibrant Black Catholic community in the US for a very long time. But because of various institutional and structural challenges, there has not been as much Black clergy. There haven't been as many Black sisters. So the leadership pipeline has been pretty small. So Cardinal Gregory has made history by being named a cardinal in the US. And certainly his prophetic leadership around the kind of protests last summer in DC, and that turned violent when law enforcement kind of turned on protesters. He denounced that. And he's continued to be, I would describe him, having interviewed him several times, he's kind of a soft-spoken guy, and I think a little nervous about wading into the political waters too much. But since his move to Washington, I get a sense that he feels maybe a little freer now, and he is kind of speaking out about these issues more forcefully and more regularly. In fact, later this month in March, he'll be hosting a dialogue about racism in the church, which should be fascinating because he certainly has a unique angle on kind of looking at events.
Definitely. Yeah. I wanted to wade into what is like even a more current topic, I guess, than talking about the racial justice movement, which is, and I want to couch it in that I have, I've seen this quote, I'm not sure who to attribute to, so I'm going to try to paraphrase it, that the individual was saying that, they've observed and they've seen that some of the most patriotic people that they've ever known are members of the African-American community and immigrant communities, despite so oftentimes being locked out of the opportunities that come with being an American. I would say, like, I have a similar parallel with members of the LGBT community, that some of the most faith-filled people who strive the hardest to try to walk the walk and the talk that Jesus guided us with are members of the LGBT community who are so often labeled and ostracized from the church, yet they continue to come back and be vibrant members of our faith communities and have a strong connection with the faith, even if they're outside of the walls of the recognized church. So throughout his papacy, Pope Francis has kind of sent some embracing messages where there's been signs of hope of a strengthening relationship and a more welcoming church for the gay, lesbian, bisexual, and trans members of our community. I remember reading about his calls with the individual who was running I think the homeless shelter for trans women in Argentina, and thinking that, like, this is pretty amazing. Like, we're acknowledging that trans individuals exist. We're saying that we as the church should be supporting them and creating safe spaces for them to live and have safety. This is a major move. And then yet at the same time, you've had a couple times now, this is just, I think, the most recent, put out position statements such as this one that kind of move us further away. So you have this action and some of his words in interviews that offer real hope of building bridges within the LGBT community in particular. And then you have official policy statements that come out of Rome and the Vatican that kind of at the same time push us away from that. And I'm wondering what your take on was of what came out this week. It was a little surprising, I think, to both of us. And how does that reconcile with some of the same actions and the calls that we've had from the church to create this welcoming and affirming love your neighbor approach to Catholicism?
Yeah, I mean, if anyone listening or watching is not familiar with the story, the Vatican's doctrinal office, the Congregation for the Doctrine of the Faith, released some guidance in response to an inquiry from bishops asking if priests would be allowed to bless same-sex unions. It wasn't quite moving toward the direction of witnessing marriages, but saying if a gay couple came to a priest and asked for a blessing, could a priest do that? And this was in response to plans in Germany where some bishops are thinking about maybe we do respond to the growing pastoral need of LGBT Catholics by moving in this direction where priests can bless a union. We're talking about something as simple as saying a prayer over this couple. Priests bless all sorts of things, new houses, new restaurants. I saw priests blessing rows of guns at this kind of blessing event for hunters. And the Vatican came out and said simply, no, they cannot do this. It's it would look too much like they're blessing the union the church considers to be sinful. They use some pretty harsh language saying God cannot bless sins. And it was a really kind of devastating story to a lot of LGBT Catholics who I interviewed in response to the story, people who reach out to me personally. I'm Gay and Catholic. Some of the podcasts that you alluded to earlier was an exploration of what it means to be gay and Catholic. So it was kind of a tough week. I think people were really surprised because it was just a few months ago where in a new documentary, Pope Francis, they unearthed some footage that showed him expressing support for same-sex civil unions, which is a position he's held for a long time, actually. He saw the possibility of maybe the church could support same-sex civil unions instead of legalizing gay marriage and thus reserving marriage as, what the church teaches as to be a union between a man and a woman. So it was kind of this whiplash where in the fall you have this big story about the Pope maybe supporting same-sex unions, and now in the spring you have the Vatican saying, God cannot bless sin, using this really kind of harsh language. And this has played out, like you alluded to, since the start of his papacy. I mean, it was way back in 2013 when the Pope was asked by a reporter what he thought about gay priests, and Francis kind of broadened it out and talked about gay people more generally and said, who am I to judge? Which led to him being named the Person of the Year by a gay magazine here in the US. It was seen as like a real opening of the Catholic Church to the LGBT community after several decades of kind of more hostile views by top church leaders. So you have that, and then you have like the more pastoral moments, like you mentioned, the Pope befriending LGBT people, saying, the church maybe owes an apology for historic mistreatment of LGBT people, versus these more, harsh reminders that church teaching has not changed and that LGBT people are in many ways considered second-class citizens in the church. So I don't know what's going on there. I started talking to some colleagues, started talking to providers of pastoral care, so priests and sisters who kind of engage with the community a little bit more. And they don't know. They think that the Pope is like, in his heart, he knows what the pastoral response is. He knows what to do. He knows to remind people that they're beloved children of God. But he might be, he's an 80-something-year-old Argentinian man who's worked in the Catholic Church for decades and decades. So he knows the rules as well. And he might be comfortable with this tension, kind of creating some dialogue, or he might be fearful of what it means to move beyond the rules, or to possibly even talk about changing the rules, which he's shown no inclination to do yet. But there is this sort of whiplash for not only LGBT Catholics, but also their family and friends who just aren't sure what to make of this. And I think over the next, coming weeks and months, we'll see. Sometimes after these harsh rulings come out, the Pope kind of responds with either a story or a gesture to show, there is a pastoral side to this too. So I wouldn't be surprised if, over the next 6 months or so, that something else happens where the Pope kind of pushes back against this a little bit. We'll see.
I do wonder, I guess is the right word. I did not grow up in the Catholic faith. I've learned a lot of it since I've been working here at Catholic Health Initiatives as I can, and kind of sucked up as much knowledge and information about formation and other things through our programming here. I find it and I don't think it's unusual. I think in the Episcopal Church, which is where I am a member, I think we have somewhat the same type of divisions where I find it troubling the variation from diocese to diocese almost around issues such as this, where I would hate to be a member of a community and I move to another state and then I can't find that I'm a welcome member of the church that I was, the same denomination, just across the country when I moved. That would be confusing as a parishioner and kind of disheartening. I think we've seen it play out a little bit with COVID, with the response to vaccination. I had this question for later, but it kind of fits in right here. You've had the Pope come out and say that getting vaccinated is a moral responsibility that we should be doing as a gesture to one, care for yourself, but to care for your neighbor. And then you have conflicting messages from local bishops about the efficacy of the vaccine and whether you should refuse. I mean, I think they don't quite understand that you don't really have a choice. Like, it's in the syringe and it's in your arm before you find out which one it is. But that you should refuse either the Johnson & Johnson, the rumors that were flying around about the Pfizer Moderna vaccines, all of which were not true. but played upon Catholic fears. I really felt like around the use of fetal cells in research, which again, like I said, wasn't a truth, but then you're trying as like you're looking to the Pope as the leader of the church. He's saying do it, but the bishop who is closer to me or the parish priest who is influencing me, every Sunday and more hopefully, is telling me something else, and then I'm trying to do what I think is the right thing for my faith, but I have two distinct messages that can't really be reconciled. Like those two things, like if this is not a good thing, refuse it, and it's your moral responsibility to do it. They can't be reconciled. So where are you left? I mean, that's what I find, I guess, confusing about why. I guess that's a question I always ask. Maybe you can't answer it. And it's true in the Episcopal Church as well. Like if something comes from the Pope, how does it then get changed by the local bishops or the local priest without there being some sort of, I don't know, repercussion isn't really the right word, but you know what I mean by that.
Yeah, no, I mean, the vaccine example is a great example of so much we could talk about, but there is, you did have Pope Francis, who has been clear that we should get vaccinated. The Vatican, I think a lot of people might not be aware, and Catholics included, the Vatican has a huge, big apparatus studying all sorts of issues, including healthcare. And they came out pretty early on, moral theologians, ethicists, scientists, medical professionals at the Vatican came out and said you should be vaccinated. There are some vaccines that are more morally acceptable, but right now, because it's a pandemic and so many lives are at risk because of this new illness, whatever vaccine you're offered, you should take, because that will help protect you and help protect your neighbor. And it sort of falls in line with church teaching about love of God and love of neighbor, so get vaccinated. So that came out pretty early on. Once vaccines started becoming more widely available in the United States, and there's 3 vaccines that are in the news, like you talked about, some bishops in the United States started kind of questioning some of that advice and looked at advice from some bioethic, kind of Catholic affiliated bioethic think tanks and said, maybe the Pfizer and Moderna ones are more morally acceptable than the Johnson & Johnson one. And there were some interesting philosophical debates about that, I won't even get into like how close you are to an act of evil. And they started putting out these statements that did cause confusion. I've seen as maybe benign as what I just said, some bishops saying like, if you had a choice, you should choose this over that, but get vaccinated whenever you can. To all the way to some bishops saying you should not take Johnson & Johnson. And not only that, but if you work in healthcare and you're Catholic, you should not distribute it. Well, that goes completely against what the Vatican has said, what the Pope has said, even what US Bishops' Conference has said. So there is this confusion. And it's fairly remarkable that you have bishops in the United States kind of openly contradicting the Vatican, the CDF, the Pope himself. And I think you're right that there is some confusion. If you're already a little hesitant of vaccines and you're Catholic and you find a bishop who kind of expresses a similar thought, maybe you latch onto that and then you don't get vaccinated, and that puts you at risk and it puts your family and the community at risk, which is not a good situation. And that's been exacerbated by the presence of right-wing media that's targeting Catholics by pumping out disinformation about vaccines, kind of seizing on to these authentic statements from real bishops, but that is going against the Pope and going against the Vatican and going against Catholic moral reasoning. So this vaccine situation is challenging and dangerous, and it's disheartening to see not only division, but division that could have real world implications for Catholics who maybe don't know what to do about the vaccine. So, I mean, the top line item is it is moral to accept any of those vaccines, and that, like the Pope said, and like several bishops have said, you actually have an obligation to do it. But we are living in this kind of strange time where it's not like what the Pope says kind of trickles down to bishops and then to priests, and then Catholics hear it and do what they're told, which is probably good. But it is, you have to like work a little harder to figure out what the truth is. And that's not always clear depending on what media you're consuming.
Yeah, it is interesting to see the polling numbers around vaccination rates. And I haven't seen anything that actually asks around religion for us to have like a figure about what percentage of Catholics are hesitant. But
there is one poll. There was one poll that was fairly encouraging from Pew Research Center that showed across white Catholics, Hispanic Catholics, and then total Catholics. That's how they broke it down. About 75% of Catholics say they have received the vaccine or are eager to as soon as they have the choice. So
That's great.
that's good, but we're still
Yeah.
talking about 25% of Catholics, which is, a big chunk of the country. There's about, 20% or so of the population is Catholic. So that's millions of people we're talking about who are either hesitant or say they don't plan on getting it. So there is this worry that if faith leaders who are often, trusted leaders in the community, if they're not actively promoting the vaccine, it could be really detrimental for some parts of the country.
Yeah, I think that's great. I wasn't aware of that study. The one I was going to be talking about was the survey where it is mostly white men who are most hesitant, which is odd, considering, you would expect it to be more within, and that's where all the talk was initially when the vaccine first started coming out, within like Catholic health care as a whole. I think we were really focusing on making sure we were addressing vaccine hesitancy in minority communities, and thought that's where we were going to hit the biggest wall. But it looks like the biggest wall is actually among white men. Not traditionally the hardest group to get vaccinated. But again,
yeah, we'll see how the church handles that. I'm not sure. I mean, we my own reporting, I made a special effort to reach out to Catholic leaders of color who can kind of talk about vaccine hesitancy. We made a video showing a Black Catholic priest getting vaccinated. And you're right, that was, that's what we thought early on based on data, what the challenges would be. And it still remains a challenge, but these new polls showing that white Republican middle-aged men are the most vaccine hesitant. Maybe I make a video with a middle-aged white Republican man getting vaccinated to try to promote that. I don't know what the answer
might have to work hard to find that, but I'm just joking. But I'm sure we can find one. But it's certainly through the equations a way in terms of. I mean, we still have issues with how to get the vaccines to poorer communities, and we certainly aren't seeing the equitable distribution of the vaccine that we would like to see. Was interesting to listen to the NPR stories around the vaccine distribution in California, where they were very much putting mass vaccination sites in minority and poor communities, and then they were finding out that who was showing up at these vaccine sites, but it was older, affluent Caucasian individuals who were still finding the shots, as opposed to the communities where you were setting up basically the tent right next to their home. Weren't able to get the appointments. So we still have a lot of work to do in terms of equitable distribution, but I think
yeah, not to belabor the point, but one thing that when I interviewed several Catholic bioethic, like moral theologians, ethicists, communications leaders, one thing they brought up that they found especially troubling about this sort of hyper focus on the Johnson & Johnson vaccine is that because it's a one-dose regimen that doesn't need to be stored at like hyper cold temperatures, it will be easier to get into vulnerable communities that don't have the resources that are required. And they found that especially troubling because if you are kind of targeting this vaccine that might be the one that you can easily get to vulnerable communities, and then if you're planting seeds of doubts about this vaccine, that's like a double whammy where you're already taking communities that need access to healthcare and then kind of making them question it. It could be really problematic and dangerous. So there is this worry that, how will that play out in rural communities? How will it play out in communities of color? So there's really this effort to try to educate Catholics about the moral, not only like licitness of all the vaccines, but responsibility to get vaccinated as well, including the Johnson & Johnson vaccine.
Mm-hmm. Yeah, I want to pivot a little bit to talk about Plague, the podcast, and I know you're working on the book version of this that's going to be coming out in October of this year. So I look forward to seeing that when it's released. Being a healthcare organization, one of the things that I found fascinating was the look back at and your touch upon Catholic healthcare in those early years and the really dark years of the AIDS pandemic. Early 80s through, I would say, mid to late 90s, when we were seeing a tremendous amount of death from it, in particular in the gay male community, but really across the board. At that time, AIDS was very much labeled as the gay cancer. Some of our viewers may not remember that's what it was called in the paper at first. Like in '81, those were the first articles that you saw, and the New York Times called it a gay cancer. I think even the CDC was referring to it in that way at the point, tying back to the KS lesions that were so common. And you had many evangelicals and televangelists on TV claiming that the disease was a punishment for God, and it's still unfortunately something that we still hear till this day. So I, maybe we hear about all of the care at the Catholic hospitals and the Catholic ministries that popped up to address AIDS. Just want to go up to a basic question, like how did Catholic healthcare, Catholic hospitals find themselves in the center of trying to create caring and compassionate treatments and care options and end-of-life options for people that, so many other elements of the church, including, from our own pulpits, people were condemning the very people that we were trying to care for and offer our compassion and love to.
Yeah, it was a very complicated time. You had a lot going on because you had gay Catholics who had been kind of more vocal as in 1960s and 70s about their place in the church. Then the 1980s hit, and early 80s, HIV and AIDS comes on the scene, and especially in big Catholic cities like New York, San Francisco, Chicago. And then you had the church that wielded a really kind of large healthcare network in these places. How do you respond to that? You have the church on the one hand, like you said, kind of condemning gay and lesbian rights. And then you have Catholic hospitals that are in heavily gay neighborhoods that are being asked to respond to the HIV and AIDS crisis. What struck me was, and this is what I ended up focusing on in Plague, you have this one Catholic hospital in New York called St. Vincent's, and it had been around for 130 years by the time HIV and AIDS becomes a big public health challenge in New York. It's located in Greenwich Village. There's a large gay population around the hospital. And just by default, really early on, you had a large gay patient population at St. Vincent's seeking care for HIV and AIDS. And there was a lot of conflict early on. It's interesting as I kind of learned the history for the first time to see that there was this Catholic hospital that was kind of synonymous with HIV and AIDS care. In many ways, it was seen as like the gold standard for HIV and AIDS care. And I was kind of curious, like, how did that happen? And it turns out it was not easy. There was a lot of pressure from gay and lesbian activists, especially in groups like ACT UP in New York, that saw that there was some abuse happening at the hospital. There was some kind of verbal confrontation from some of the hospital staff towards the gay community. Things as simple but as upsetting as not being allowed in an exam room with your partner because you're of the same sex or you're not legally married, to taunting or jokes from either the security staff. Or I interviewed a doctor who said that he was sympathetic to the gay men who were coming in for care, but he heard jokes from some of the other staff about kind of making fun of this patient population for contracting this virus. So it was really a challenging cultural transformation. And at least at this one hospital, it was pressure from activists, but then also a group of sisters, the Sisters of Charity of New York, who ran St. Vincent's, who said, they're upset, they're saying mean things, but we can take it, we're adults, let's ask them why, let's engage and see what we need to change. And to their credit, they did spend time changing. They opened up an HIV and AIDS clinic. Dr. Ramon Torres was became a big name in HIV and AIDS care. He ran this clinic, and when I interviewed him, he said that, yeah, there were definitely cultural challenges because you had this kind of conservative Catholic archbishop in New York at the time, and you had this hospital that kind of reported to him, and there was that. But also he said the Catholic Church is known for reaching out to vulnerable populations. So he really admired that the hospital made it a point not to treat just the mostly white gay men who live nearby, but they went out into the boroughs and said, who's not being served? And he's created a big part of his clinic was serving a homeless population. He said it was mostly communities of color who didn't have access to other hospitals. He would make sure that at this clinic they could receive care. And he said, bit by bit, that became kind of the core of his patient population. And he said that he was fully supported by the hospital in his attempt to do that, even though it cost money and time. So there was this sort of gradual shift over the years to what we know today, St. Vincent's, which is now closed, unfortunately, but was sort of seen as this place that provided excellent medical care to a community in need. And this played out all over the country, kind of over the course of the podcast and then in the book that's coming out later this year. I don't just focus on New York, even though it's a big part of it, but places like Belleville, Illinois, which is kind of a small city just across the river from St. Louis. There were similar efforts by a small group of Catholic nuns to open an HIV and AIDS drop-in center. I interviewed nuns from Louisville, Kentucky, doing the same thing. So across the country, in places you might not expect, the church was responding, but it wasn't always an easy start. There was a lot to learn, both in the Catholic community from the gay and lesbian activists. And then I think the church did win over some activists who rightly were putting pressure on the church to do more. So it was a contentious relationship that I think ultimately provided some good care. So there was kind of a fruitful exchange between the two groups.
Yeah, I do think it's fascinating that you do see the pattern repeated. So it wasn't just like a New York City and a San Francisco phenomenon. Because I can remember in the early 2000, I went to Michigan to do some consulting work in Grand Rapids, and I asked like where the largest AIDS clinic was, and it wasn't at the largest health system, in the Grand Rapids area. It was at I think it was St. Mary's, which was the Catholic hospital in town, and that's where the hepatitis clinic was, and that's where the HIV clinic was, because it's more the harder to treat, the more expensive, the less profitable hospital and diseases to treat. That the Catholic hospitals continuously stepped up and tried to do the best they could, not letting the revenue gain be the deciding factor on if they would act or not. I think the one point that you talked about St. Vincent's. I can remember that hospital well, having visited New York many times, and it left a big hole in that community when it closed, which is not just from the Greenwich Village, but I think all of New York kind of felt like when that closed. Probably not unlike when, like on a much smaller scale, when we closed St. Joseph Hospital here, that was the last Catholic hospital right in this area. There's still other Catholic hospitals around, but in New York City, St. Vincent was the last Catholic hospital on the island of Manhattan.
Yep.
And I think that's significant, that there is, and I'm curious what your thoughts are in terms of like, what does a community lose? Like, so when the Catholic presence in healthcare is gone, which is the case in New York City right now, not that we don't have other health ministries, but we don't have a Catholic hospital there. What do we lose? Or I guess the better way to look at it, since we're being optimistic today, is like, what do other communities gain from having that strong Catholic healthcare presence in their communities?
Yeah, this has been a topic that's been on my mind the last several months. Back in December, I wrote about Mercy Hospital here in Chicago, which was the first Catholic hospital here in the city. It operates on the near south side in predominantly a Black community. And unfortunately, it is closing. The owners, the health system that runs it, has said that it's no longer financially profitable, or not profitable, it's a nonprofit, financially sustainable operation. And they came up with a couple plans they presented to try to save it by kind of partnering with other Catholic hospitals, but ultimately they didn't receive the state funding they sought, and they decided to close the hospital. And I was really struck by the way the community rallied around the hospital. I spoke to several community leaders who said that it would just be devastating because this is already an area that's experienced a lot of disinvestment. There's not a lot of medical care available at all. And they pointed out that, if the hospital closes and the emergency department goes away, that the nearest emergency departments will, be pretty far away in terms of, what you expect in an urban setting. And that's a very busy hospital ER right now. So it was interesting to see in real time what places like St. Vincent's and other cities that have gone through kind of losing the Catholic hospital, what that means for a community. And, the healthcare landscape has changed a lot since the 1800s, when these hospitals were founded by large groups of women religious, often, who could staff them and provide medical care to the indigent. But the mission hasn't changed as much. And that's one of the challenges, is Catholic hospitals often do provide care to communities that, quite frankly, don't have the good private insurance to pay for it, and are relying on Medicare, Medicaid, and the reimbursements are lower, and it gets into all these messy finances. But caring for the poor as a mission is kind of what motivates lots of these Catholic hospitals. But the financial reality is that is very difficult, and without a lot of government investment, it's just not sustainable. And we're seeing that play out around the country. So what communities gain are, partners who want to help kind of fill some of the gaps that exist between poor communities and then available resources. And then when those hospitals go away because of financial realities, it is really a difficult situation that I don't think we know yet what the solution is. If some hospital networks, including Mercy Hospital here in Chicago, like I mentioned, they are planning to open clinics, and they say that they can provide some of the kinds of care that these communities need, but rightly so, community activists worry that it's not enough. So it's a phenomenon that I think will continue to play out around the country over the coming years as healthcare continues to consolidate and it becomes more difficult to provide care to the poor.
Yeah, one of the issues that I had talked about, we had done an interview with Sister Mary Haddard, who is the head of the Catholic Health Association of America. And an issue that I raised with her that is concerning to me, and I would love to see us more involved with it in terms of Catholic healthcare, is the plight of rural hospitals and the fact that so many isolated communities already, in terms of limited resources and great distances to other resources, are seeing their local community hospitals, which again, probably weren't big hospitals. You're talking 20, 25 beds, maybe, probably not an extensive array of specialty care beyond the basics, but were like a safety net for that community. And so many of them are closing across the country because of the financial challenges associated with it. And the fact that Sister Mary pointed out to me that I was not aware of is that Catholic health systems have not closed a single one of those hospitals. And while I applaud that, I would love to see us as a industry isn't really the right word, but as a movement, I guess, or a ministry of the church, say, okay, not only are we not going to close our own, but we're going to try to solve the problem as a whole. And I realize there's finances that are well above my pay grade to figure out with that. But I think it's a worthy challenge for us as a church ministry to take on, is if we say that we're to uphold human dignity and create opportunity, that we have to make sure people are well, or how do we achieve that? People lose their dignity very quickly through illness, unfortunately, and I think we have a way to affirm that. So one thing else that also really struck me about the podcast, and I think I mentioned to you when you and I were emailing back and forth about coming on to do this interview, was this idea of the visibility of the church's response. That and we talked a little bit about it, and you tell the story of the Archbishop of New York, who again had a tremendously contentious relationship with the LGBT community, going to St. Vincent's in private to minister to the individuals who were struggling and dying of AIDS, but it was never made public that he was doing this, or I'm not aware of it, and I don't think you make reference to any public acknowledgement. And to me, I'm not like looking for this big media splash, but even just the reference that the Archbishop was making these trips and caring for and ministering to would have had such a huge impact upon so many people of faith that were struggling with AIDS or may have been living with HIV themselves, to know that there was care and compassion from church leadership. I realize like you and I haven't talked to him. He's no longer with us to talk to. What do you think some of the rationale was for keeping that private, that you've heard in the interviews that you've done? And do you also, similar to like how I kind of feel about it, that it was a real missed opportunity for us to have a powerful exchange, powerful influence beyond just those hospital rooms, which I'm sure he had a tremendous influence in while he was there?
Yeah, no, it's an interesting question. I hadn't thought about it like that. If you were in the hospital, if you were, let's stick with New York, if you were kind of admitted to the AIDS ward at St. Vincent's, you would probably know that there was a Catholic response, because you had Catholic sisters who were on the pastoral care team. There's one Sister Patrice Murphy, who almost everyone I interviewed in New York kind of mentioned, and she was well known in the LGBT community as an ally. She was at the hospital kind of working with the chaplains to make sure that they knew how to interact with the LGBT community. She made them go through training at Gay Men's Health Crisis. She received awards from the gay and lesbian community in New York. The chaplains I interviewed talked about how wonderful she was. So if you were on, in the hospital, or you were visiting friends in the hospital, you probably did know that there was a pastoral response from Catholic leaders. But those were quiet visits away from reporters most of the time, like you said. And then you had very influential, I think it's difficult for someone who didn't live through it at the time to understand the political influence that Catholic leaders had. much more so than today. We're talking about before the sex abuse crisis kind of eroded the moral stature of the Catholic hierarchy in the United States. You had someone like Cardinal John O'Connor, the Archbishop of New York, who was, a daily fixture in the tabloid in the cities. He was friends with the president, President Reagan, friends with the mayor. He was a very powerful person who regularly spoke out against gay and lesbian civil rights pushes in the cities. He sued to overturn, special or just laws that would protect gays and lesbians from discrimination. And he did announce that he would visit people on the AIDS ward at St. Vincent's and St. Clair's, another Catholic hospital in New York. This has always perplexed me. He announced that he would visit 1,000 people with AIDS. And he had this exact number that he was very committed to. And then he announced on the Charlie Rose show in 1994 that he had not only visited 1,000, he actually got to 1,100, and he was very proud of that. And I found that so odd that he kept track of the number of people he visited. And I was kind of curious, like how involved were these visits? That's a lot of people to visit over the course of just a couple of years. But so he didn't hide it, but there were never reporters there. There were never, photographers or people kind of videotaping the visits. And it was always seen as a quiet pastoral moment. Another odd aspect of that story was no one I interviewed ever saw him there, but they insisted that he did it, and they could tell me, like, you just knew he was there. So I found that interesting. And I did interview a sister, Sister Pascal Conforti, who did great HIV and AIDS ministry at St. Clair's Hospital, who was very friendly to the LGBT community. Again, another advocate, ally. And she was a pretty strong defender of Cardinal O'Connor. And, she said, look, he was there. He was visiting people. It was a private moment. If you're sick, you don't want photographers and journalists in a room taking pictures of you. They didn't even know he was a cardinal often. They thought he was just another chaplain at the hospital. So I don't know what to make of it. Could he have used his public platform to be a stronger advocate for people with AIDS? Yes, absolutely. There's no question about that. Even I think his defenders would admit that when it came to how he handled that as I would say political leader, as a church leader, it was not always great. It's difficult to fight against gay civil rights on Friday, and then on Sunday, be visiting someone in the hospital. So I don't know. On the other hand, there were bishops around the country who were doing, I think, a better job of listening to the gay community. So in one of the plague episodes, I talked to people who worked with Archbishop John Quinn in San Francisco, who was also protested against, but then listened in a way that I think Cardinal O'Connor never did. And as a result, kind of, even if he never warmed up and became sort of a celebrated ally like some of the sisters in New York did, he kind of let the gay community do their thing and let a parish that served them thrive. So there are different approaches. Cardinal O'Connor, I think, I don't know how history will judge him. The podcast is kind of history now, and I've heard, lots of opinion from listeners. So I think he probably could have done a little bit more from his soapbox in terms of helping to relieve some of that stigma that a lot of people with AIDS faced.
I think it's interesting too. You brought up the sisters, and obviously we were founded by the Sisters of St. Francis of Philadelphia here, just outside of the Philadelphia area, and they, the perception of sisters in the community, as opposed to church leadership or priests in the community, is in my experience vastly different in terms of how people perceive the sisters, the response of the sisters to community needs and pandemics, that they have successfully in many ways, and not all orders, but many orders built really strong, meaningful bridges and relationships with the communities. And I understand they're not tied to parishes, they're not saying mass, 2-3 times a day. But I haven't experienced that same level of involvement from the parish priests out in our community, where we'd love to see them involved with us, engaging with the community. But we can build that connection with sisters who will offer us, spiritual guidance and advice and practical experience from, starting their health systems or running the shelters that are continued to be part of their ministry in a way that the formal church leadership in terms of the male hierarchy seems more disconnected from the community in that way. And I wonder if there's a way to bridge that.
Yeah, no, it's an interesting observation. There are communities of sisters and also communities of Catholic brothers, some communities of priests who, it is a calling, right? Like sometimes you join a religious order because you're interested in healthcare ministry. So that kind of makes sense that you have groups of sisters who are working in this. Or here in Chicago, the Alexian brothers who opened an AIDS hospice back in the 80s. And a lot of those orders are actually, they've shrank down quite a bit. And that's why we're seeing a lot of these Catholic healthcare entities struggle and then maybe go out of business or change, have to affiliate. But yeah, there is, I think, a sense that religious communities, we're talking about groups of sisters, nuns, groups of religious brothers, they're not maybe always as kind of plugged into the power struggles or the kind of hierarchy side of the Catholic world. Like they have their role and they have their ministry and they do what they can and they kind of form community partnerships. But the diocesan priesthood, so priests and parishes, bishops, like that's another calling, right? And they kind of provide ministry in parishes. And it would be great to kind of get everyone on board, like united behind a similar mission. But I do see like why there are different callings. The Catholic sisters, I mean, there's so many heroic sisters who do such good work, and it's kind of such at odds with like the their caricature in popular culture, right? Kind of like the mean like ruler, like yielding or wielding nun at a Catholic school. So I am always really grateful to get stories out about heroic Catholic sisters who just are in the trenches doing the hard work, often ignored by the male hierarchy and the kind of male-oriented church. So the more stories about like Sister Patrice, Sister Carol, who's one of my main characters in the book, like those are the stories people should read about for inspiration, especially like if you're, to go back to our earlier conversations, if you're upset about the Vatican pronouncement this week about gay and lesbian Catholics, go read about Catholic sisters who have done incredible LGBT ministry for decades and decades and are kind of still very much on the cutting edge of providing this kind of care in the church today.
And you saw the divide, right? That when even with the Affordable Care Act, you saw the conference on bishops, the conference of bishops oppose, and the sisters endorse. There was and it's good to have debate. It just would be nice to see them eventually come to some resolution and mutual respect. I always joke with my staff. We had a member of our staff that had joined us a couple years before we had some of the senior leadership from the Sisters of St. Francis of Philadelphia come visit us, and I took some staff out to breakfast with them because I wanted them to see them not just as like a caricature of a sister or someone we talk about from the past, but like these are real life amazing individuals that we need to cherish while we have time with them.
Yes.
And I remember her leaving that meeting and she goes, that was the first time that I ever met a nun and I liked it. And I was like, of course you did. Of course you did.
Yeah.
But you're so bought into the stereotype of the ruler and the parochial schools that we don't actually open up to who they truly are and the amazing things that they're doing in our communities.
Yeah, I mean, it's not maybe the ideal way, but just reading obituaries of some of the Catholic sisters who passed away and just the heroic lives they led and sort of amazing stories of fighting for social justice. It's just, we're losing a whole generation of women whose stories just need to be out there. And that's part of what I was doing with this Plague podcast and in the book this fall is just, capturing, 5 or 6 of these stories and really like reminding people that these women in the church are doing, the gospel work. They're on the front lines doing it every day.
Definitely true. Thank you so much for your time, Mike. I know, I think we've actually gone over the time that I'd asked you to give us, so I really appreciate that. Have a wonderful afternoon and enjoy the spring as we finally seem to have hit that time of year.
Yeah, let's hope so. Thanks, Phil.
Yep, stay safe.